Good morning students. Today's class we will see about the supplementary examination question paper of 2018 nursing education. The first is the question is explain the importance of acquiring nursing skills and describe the role of learning environment in clinical learning. The clinical learning environment contains four attribute characteristics affecting student learning experience. These include the physical space, the psychological and interaction factors, the organization, culture and teaching and learning components. The clinical learning environment is one of the most important classrooms for pre-service students. This environment offers a range of planned and unplanned opportunities for learners to practice and achieve the competencies they need. The clinical placements are in short supply for most disciplines and may not always be supportive as learners hope for. Clinical teachers can find foundational guidance of their own courses in curricular structure, model, design, outcomes, evaluation methods, admission requirements, and tactics for leveling the student learning. Both unplanned and planned aspects of learning must be expected. University training programs for health professionals are separate from most clinical agencies, so clinical staff responsible for guiding learners may not be fully aware of their students' program. Describe the role of learning environment in clinical learning. Nursing skills enable the nursing professionals to effectively and accurately care for other individuals. Often, those who are in sick or those who cannot care for themselves having the appropriate skills also ensure nurses can work with their other medical professionals to improve the most comprehensive and individualized support to all patients. Nurses must go through the extensive education and training to become qualified to practice as a nurse. During this education and training, nursing professionals learn and master the most important nursing skills needed to be successful in their careers. How to improve the nursing skill? The first, continue learning. There are several higher education options available for nurses, and all of these provide ample opportunity to improve nursing skill. Common continued learning options include bachelor's degree in nursing certifications and other volunteer opportunities in healthcare institutions. Become familiar with the different areas of nursing. There are several areas of specialties within the nursing profession, and more these specialties you are familiar with, the more you are able to contribute to your workplace. Common specialties considered learning include critical care, neonatal, pain management, and trauma. Read industry and research publications related to healthcare. There are several ways to stay updated on the latest developments in the medical field. The one way being read industry and research publications. Keeping up to date with these publications can give you a larger knowledge base and allow you to contribute in the new ways to the patient care. Become a member of nursing organization. Nursing organizations such as American Nurses Association and National League of Nursing in America and Trained Nurses Association and our local council registrations are the various opportunities to participate in continuing education in the nursing field, including conferences, educational courses, and access to the latest medical research. Practice communication. Regularly practicing your communication skills can make you a better nurse. Ways to practice include learning and watching nonverbal cues, practicing active listening, and recording yourself communicating to get better understanding of your strengths and your weakness. Along with the basic educational requirements, you must learn embedding certain qualities and skills to become a registered nurse. If these skills should be generally acquired in the nursing school, it can be still important to demonstrate while practicing. Second, classify educational objective. Enumerate cognitive domain with examples. There are three levels. That is cognitive, which is concerned with knowledge and intellectual abilities. Second is affective, which is concerned with attitude, values, interest, and appreciation. And third is psychomotor domain, concerned with motor skills. Enumerate cognitive domain with examples. Knowledge. Recalls after the class. After the class on immunity, the students will able to define immunity. Second step is comprehension. That is the lowest level of understanding, one step beyond simple understanding as evidenced by learners' ability to make limited use of information in the form of translation. For example, classify the liver cirrhosis based on its etiology. The verbs used in the comprehension include identify, justify, select, indicate. The third one is application. Ability to use learned materials, just principles, concepts to a new and real situations. The verbs used as predict, select, choose, demonstrate. For example, demonstrate the correct use of pulse oximeter. The fourth one is analysis, ability to break down the information into small components or parts, which may be elements of information, relationship between elements, distinguish between say, physiological edema and pathological edema. Third one is synthesis, combine different parts to form a new word, a new solution for waste management. Evaluation, the last one, ability to judge and the value of material for a given purpose. Judgment are to be based on definitive criteria. For example, compare and contrast any two definitions of education. The third question is pragmatism in nursing education. Pragmatism and aim of education. Pragmatism does not believe preconceived aims of education. Education becomes a laboratory of life. Consider while forming aims, creation of new values, activity and exercise, personal and social adjustment, reconstruction of experience, and all-round personality development. Method of teaching according to a purpose pragmatism gives importance to child rather than books or teachers. Avoid outdated and rigid method of learning. Methods include learning by doing, provision of real life situation like project method, and discussion, questioning, and inquiry. Discipline gives a lot of freedom to children. Teacher is act as just as a guide. Self-discipline acts guide in a happy and free environment. The self-discipline that means not exposed by any authority. Social discipline, participation in the school and society. Teacher creates a real life situation, child interested to solve these problems. Keep the student as discoverer and experimenter, not impose anything. Child will decide on aim, goal, not a dictator, only leader of the group activities. As a friend, philosopher, and a guide can maintain a close relationship. In education, the nursing educator should create a real-life situation, experimentation of discover by doing, improve the skills of students. Nursing students, they use self-effort, skill development, creativity, and observe and analyze the situation, improve their clinical skill, intellectual and moral skills. Pragmatism promotes respect for the individual as it appreciates that each person has unique needs. Additionally, pragmatism promotes critical thinking and flexibility in nursing practice as nurses can explore a range of options without negating the particular paradigm of theory. The fourth question, teacher's role in disciplinary problem. The term discipline refers to orderly activities by a person in the progress towards attainment of some goal which either they themselves desire or which someone desires for them. The general guidelines for managing disciplinary problem: first, give the students good standards of conduct instead of rules. Use positive approach, not a negative approach. Offer a challenge. Most students respond to wholeheartedly to a challenge if it is within the scope of their abilities. Definitely relate act of misconduct to act of correction, otherwise it is not educative. Do not punish the whole group for the mistake done by one or two individuals. Do not let disciplinary measures interfere with other educative activities. Make correction consistent to favor and excuse some students and correct others. To tighten the discipline one day and relax on next. All tend to lessen the students' respect for the teacher. Use deferred action in preference to immediate action as far as possible. Be certain of guilt before administering correction. Undeserved correction produces unfavorable attitude and embitters the student against the teacher. Preventive measures, that means effective classroom management. Begin the class promptly. Teachers should not delay in the class due to lack of preparation on the part of teacher. Plan the classroom activities so that all students are busy at all time. Idleness invite trouble. Teaching plans of interesting and vague topics should be blended properly. Assume a position in a classroom so that all students can see and hear. Speak clearly, convincingly, and sufficiently loudly. Do not speak in a commanding or monotonous voice. Watch for lack of interest, discontent, and misbehavior and try to stimulate interest. Assume a cooperative we attitude. The class should be teacher directed and not teacher dominated. Give the students an opportunity and responsibility to plan the class activities. Students themselves should be taught to speak loudly enough so that they can be heard instead of parroting the students' questions and answers. State the question first, then address the individual student. Teachers should always be fully prepared. Lack of knowledge on the subject matter on the part of the teacher may lead to loss of respect and ultimately go to the disciplinary problems. Use right method of teaching. Make the subject matter understandable and interesting. Do not openly anticipate disorder in advance by prescribing rules, punishment, and threats for misconduct that has not yet occurred. To threaten is to invite opposition. The fifth question is guidelines for organizing OSPE. OSPE is an objective structure practical examination. Objective structure practical examination consists of 15 to 20 stations, each of which require about 4 to 5 minutes of time. All stations should be capable of being completed in the same time. The students are rotated through the all stations and have to move to the next station at the signal. Since the stations are generally independent, students can start at any of procedure station and complete the cycle. Thus, using 15 stations of 4 minutes each, 15 students can complete the examination within 1 hour. Each station is designed to test component of a clinical competence. About 30 seconds is kept for moving to next station. When there are many number of stations, 2 rest stations can be placed between to give the student a chance to organize their thought. Instructions led to OSCE or OSPE should be given to the students in advance. Coupled or double stations, some competencies may best assess by coupling a link station. For example, coupled station may consist of a history and physical examination combined with problem solving station. Arrangement of stations. Instruction for station up. List the equipments required for the station. Instruction for or questions to be performed by the candidate. Materials like table, chair, couch and other materials are required for the task. Patient or the subject and accessor or examiner. Time frame for changing signal. Once a task is finalized at each station, checklist, questions, answer keys, and response sheet has to be prepared. Patients or simulated patients have to be selected and briefed about their role at the particular station. Each member in the examination team has to be made clear about their roles. The venue has to be prepared. Preparation of checklist. The checklist should be complete and include the main components. Unnecessary or exaggerated term must be avoided. All such stations there are observers with agreed checklist to score students' performance. Weightage for each item in the checklist can be decided by the examiners depending on their importance. Characteristic of a good MCQ. Writing the good multiple choice test questions. Multiple choice questions are also known as items can be effective and efficient way to assess learning outcome. Multiple choice test items have several potential advantages. First one is versatility. Multiple choice item can be written to assess various levels of learning outcomes from basic recall to application, analysis and evaluation. Because the students are choosing from a set of potential answers, however, there are obvious limits on what they can be tested with multiple choice questions. For example, they are not given an effective way to test students' ability to organize thoughts or articulate explanations or creative ideas. Reliability. It is defined as the degree to which the test consistently measures or learning outcome. Multiple choice test items are less susceptible to guessing than true or false questions, making them a more reliable means of assessment. The reliability is enhanced when the number of multiple choice items focused on a single learning objective is increased. In addition, the objective scoring associated with multiple choice test items frees them from problems with the scorer inconsistency that can be plagued scoring of easy essay questions. Validity is a degree to which the test measures the learning outcomes it proposes to measure. Because student can typically answer a multiple choice item as much quickly than an essay question. The test based on multiple choice item typically focus on relatively broad representation of course material, thus increasing the validity of assessment. The guidelines for demonstration. Planning and preparation phase. They set a well-defined objective based on theoretical knowledge and need of the students. Review related knowledge. Based on scientific principles, split the demonstration into appropriate steps so that students can easily follow the demonstration. Do rehearsals as needed for attaining the proficiency required for conducting the demonstration. If demonstration involve a patient, consider their safety also. Create a conducive learning environment by providing adequate facilities, especially the facility to observe the demonstration. Plan for maximum student participation. Ensure adequacy and good working condition of the equipments. Plan for return demonstration. Give necessary guidance to the students for achieving the objectives and explain what is expected. Prepare a checklist regarding articles and steps. Preparation of know the object, know the group and their level, understand the procedure, review the steps of procedure, use true life setting, assemble the equipment, ensure good view, advanced knowledge, use a positive approach, perform step in a sequence, offering running comments, judged speed and timing, discussion period, and written demonstration. Whenever possible, involve the students in the performance phase. In between, ask questions and encourage to seek clarification. Replace the article, demonstrate aftercare of the articles, show the recording of the procedure, conclude the performance phase with a discussion. The eighth question is law of learning. According to Tonteki, the law is readiness, law of effect, law of exercise, law of multiple response, law of attitude, law of analogy, and law of associate shifting. Elements of an object lesson plan include objective, introduction, presentation, review, activities, ABS, assignment, reference, recapitulation, and evaluation. Qualities of an evaluation tool: validity, reliability, objectivity, practicability, relevance, specificity. Others include discrimination power, efficiency, precise and clear, comprehensive, and length. Three-dimensional aids include model, exhibit, specimen, mock-up, merge, object, diorama. Characteristic of adult learners include self-directions, practical and result-oriented, less open-minded, slower learning, yet more integrative knowledge. Use personal experience as a resource, motivation, multi-level responsibilities, and high expectations. Difference between a symposium and panel discussion. Panel discussion is the method of teaching in which 4 or 6 or 8 persons discuss an assigned topic or issue or a problem creatively among themselves in front of a large audience. Main functions include provide information of and new facts, analyze the current problem from different angles, identify the values, organize for mental recreation, influence the audience to an open-minded attitude and respect for others' opinion, and to stimulate thought and discussion and clarify thinking. Symposium: the topics are related to the controversial issues in nursing. Single aspect of the topic is discussed. Chairperson has to exert more control on the members, more time for discuss involving the participants, demand more participation from the side of the participants. Comprehension synthesis. Comprehension is the lowest level of understanding, one step beyond simple understanding, as evidenced by learners' ability to make limited use of information in the form of translation. Synthesis combines different parts of a from a new word. Poster and a chart. A poster is an informational educational tool in which we can reach many people in many locations. It's a visual combination of an illustrations of message conveyed. Purposes: to provide general interventions, to create aesthetic or atmosphere effect, to communicate more general idea, to trust a message for leading to action, used to teach in the classroom and in the community. Advantages: it attracts attention, it conveys message very quickly, does not require detailed study. Good poster leads to action with good motivation. It can stand alone and self-explanatory. Disadvantage: a poster does not always give enough function. When a poster is seen often, it becomes a part of environment and there is no longer attract attention. A chart is defined a visual symbol summarizing, comparing, contrasting, or performing other helpful service explaining the subject matter. It is meant to depict the pictorial and written information's systematic way, effective arrangement of key facts. Purpose: to visualize an item. It is otherwise difficult to explain only in the words. To highlight important points, to provide outline material covered in the presentation. Advantage: it is an effective learning tool for learning. It arouses interest, it involves low cost, it is portable, easy to make, available for use and reuse. Used to explain, clarify, simplify the complicated materials. It can be used to compare and show relationship. It attracts attention, reduces the amount of verbal explanation and encourage action. Disadvantages of chart include: chart cannot be used for a larger group, it cannot be used for illiterate group also. Philosophy and objective. The dictionary meaning of philosophy is theoretical or logical analysis of principles underlying the conduct, thought, knowledge, and nature of universe. Philosophy which determine all broad aspects of education like aims, curriculum, objectives, teaching methods, school discipline, teacher's role. Philosophy is a science of knowledge and knowledge is an antidote to ignorance. Education is a purposeful activity and to bring behavior changes. To bring behavior changes, we have to formulate the objectives. Objectives are the debate what the students should be able to do at the end of the learning activity. An educational objective are more focused on learners' performance. It is also called learning objective. Educational objectives are the statements of those desired changes in a behavior as a result of a specific teaching learning activities. Knowledge ability, skill, attitude, appreciation, and interest which the student develop as a result of the teaching learning activities. What the students should be able to do at the end of the learning activity, what they could not do beforehand. Nursing rounds and bedside clinic. Bedside clinic is an organized clinical instructions in the presence of a patient. The teacher-centered method means to a small group of students name of the patient, other details, and venue should be informed prior. Depending on the patient's condition, it can be conducted at the bedside or near the clinical teaching room. Usual duration is 30 to 45 minutes. Learning experience is essentially discussed with total care of the patient, specific nursing care, observations and recorded data and other implications, the patient reactions, response to care and progress, medical and surgical treatment and consequence regarding how they relate to and affect the nature of care. As a clinical teaching method, nursing round is a modified version of a bedside clinic. Nursing rounds conducted by the head nurses or the nurse teachers for the members of their staff or the students for clear understanding of a disease process and effect of nursing care of each patient. A small group of staff members, not more than 5, and a leader or a teacher visit bedside of the clients. This helps the nursing members to know about all patients in the ward, their problems and way of solving. In bedside clinic, detailed discussion regarding the nursing care of a single patient is carried out, but where in nursing rounds, only few minutes spent in each patient, short discussion of all patients in the ward. Thank you. Thank you for listening.